Hello, hi everyone. Welcome to another ATP Live. I'm excited because it's the first ATP Live in the year 2019. Hooray! And we have so many things packed up for you for the year. We hope you have a nice time this year. All right, we're about to start. Dr. Bimi is in the house. And we're talking about one topic that has been coming on and on and on and on and on. And I'm excited that this is the topic of fix for today. So I'd like you to invite your friends, to share the videos, send the message out. ATP Live has started so that people can watch and learn and have an opportunity to ask their questions. Dr. Bimi is in the house. Good morning, Dr. Bimi. How are you this morning? Happy
Hi.
New Year.
Good morning, Okwe. Thank you so much, everyone, for joining us on ATP Live. And once again, let me use this opportunity to wish every one of you a happy new year. And we wish you an healthy 2019, especially for
19.
our wonderful children. And ATP is your partner in ensuring that everyone is healthy in 2019. So we're happy to be here this morning on ATP Live. And this year, we've decided to change things around a little bit. So, in our ATP group discussion, the professionals will be talking to you about what we think we should teach parents, what we think you should know. But on ATP Live, it is your show. So, you tell us whatever you want us to talk about. I know we put up a poll the other time for you to tell us what you would like us to talk about in 2019. And this is one of the commonest thing everybody wants us to talk about. So that's why. So don't be worried when you get some funny titles this year on ATP Live, because we're just going to be talking about exactly what you really want us to talk about. So thank you so much for joining us this morning. You're welcome.
All right, you have heard it from Dr. Bimi. We're going to be talking about what you want us to talk about. So, ATP Live is your show. It's not just an ATP show, okay? You can decide. I also want to encourage you to please invite your friends to join us. We're starting. And it's an opportunity to ask your questions live. Dr. Bimi is here. All right. Dr. Bimi, we're talking about cough. Okay, cough in children, of course, we know because, sorry, ma, you know,
Okay, thank you.
it's the children we're here for, basically.
Yeah.
Coughing
Yes.
children. It's very paramount. Like it happens all the time. At school, school just resumed, and Dr. Bimi,
Yeah.
the cough is spreading already.
Yeah.
it's something we face all the time. What exactly causes cough? Is it the cold weather? Is it, I don't know. What exactly causes cough? You're the professional. Please tell us.
Okay, so when we're talking about uh, cough is like a reflex. So we're going to first start by describing what is cough. So I'll start by coughing.
Sorry.
Okay, so that's a cough. So cough
Okay.
is a reflex. Is a natural reflex. So it's what the body does to clear out whatever when the body thinks there's something along the airway that is a threat, or that is an irritant, or that is foreign, but the body continuously wants to clear it away. And that cough is that reflex, is that process by which the body tries to remove whatever it thinks should not be along the airway. So the cough is a very good reflex. It's a protective reflex. It's a good thing. If you cannot cough, I will be worried about you. If a child cannot cough, I will be worried about you. So there's nothing wrong with cough. And so cough is normal. Is So we cough most times when there's something in our airway that the body perceives as a threat. It could be water, it could be irritants, it could be anything could irritate the airway. Then the body coughs as a way of trying to quickly get rid of that whatever is on
Obstruction.
the airway that is causing the problem. However, cough now becomes a problem when, like I coughed now and I stopped. Hopefully, I've cleared whatever it is that is stopping my airway. But when somebody now keeps on coughing, 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 because the body perceives that whatever is there is not yet out, so it keeps on coughing. And then that is when we perceive it as as a problem, and that is when it starts telling us that, okay, I've tried to clear what is there, but it seems not to be going away.
Okay.
I need help. So when a child is coughing persistently, it's trying to tell us, I've tried to do what I think I should do, but I am not able to complete this job. The thing is still there. Please help me. So that is what persistent cough is telling us. So I really want parents to understand what cough is and why it is there, so that when we begin to talk about certain things down the line, you will understand, yeah, what we mean.
All
Okay.
right.
All right.
Dr. Bemi,
Esther,
thank you
thank you
so
for
much.
joining us all the way from Australia. Good
Australia.
morning.
Wow.
Okay, good
Good
evening in
morning, Australia.
Australia. It's good morning in us and in London. Okay, go on.
All right. Thank you for the general definition, Dr. Bimi. But sometimes we have, okay, you said when the cough is persistent, then something is wrong. Is cough always an underlying effect of something, or cough is just cough?
Okay, so like I tried said, when you try to clear your airway, that is, you cough once and you stopped. But when you are
Okay.
coughing persistently, and when a child is coughing, like as a mom, when a child cough, I just listen and I'm like, okay, I'll watch. Then if another 5 minutes the child is coughing again,
Coughing
that's a point
again.
where you actually begin to count. You
Okay.
begin to count how many times the child is coughing. Then um that is now something worrisome, and you begin to wonder what is causing this cough. So like I said, that is a pointer to us that there's something wrong, and the body system is telling us, I'm not able to cope, I need help. And so that is when we now want to know what is causing this cough. So there are many things that
This
could cause
cough.
a cough. So that is one of the reasons why when people just ask us on ACP, oh, my child is coughing, what should I
What
give?
can I do?
It doesn't, it's difficult for anybody to answer that question, because we need to know what is causing this cough. Okay, so for example, if a child is eating and the food went the wrong way, maybe into the airway, because the airway and the food way, they are like in front of each other. The airway is in the front, and the food or the gastrointestinal tract is just behind it, and they have a common uh, passage. They open into a common passage, which after which everything finds its own way. So sometimes
Yes.
in some things happen, the during the common passage, instead of the food going to its own pathway, it tries to go to the
Airway.
airway part. Then that causes a problem, and the body natural reflex is to cough it out. It's to cough it out. And so in that case, when you cough it out, most time you're able to dislodge it immediately, and then you'll be all right. But sometimes when
Okay.
there are infections, when there are other things that has gone down that pathway, that airway, the children begin to cough as a way of trying to get rid of that irritant or that foreign body in the airway. And that is when cough is. And the airway is a long pathway, starting from your nose down to what we call the pharynx, which is a common pathway. Then it goes down into the what we call the trachea, which is around the neck area. Then goes down into the breaks into the what we call the bronchi, which are like large airway, large pipe airway. Then it breaks down to get to the lungs, where you have this into small sacs. So any problem along each any of this pathway can cause children to cough. And there are many things that could cause cough in children. Because we are beginning to talk about children, I'm not going to narrow it down to what happens in children. So the commonest reason why children will cough is because of infections, what we call acute
Okay.
respiratory infections. And acute respiratory infections can affect any of these airway pathway, right from the nose down to the lungs, or to the what we call the alveoli in the lungs. So sometimes
Okay.
when it happens to the upper part of the airway, we call it upper airway if upper airway infection. Sometimes it can affect the lower airway
Airway.
as well. And there are different organisms that could cause it. So in the upper airway, you tend to get symptoms. There are other symptoms that come with the cough that help us to give us some idea whether it's an upper airway cough or
Airway.
is it a lower airway cough.
Airway.
So for upper airway cough, there's a lot of noise in the breathing, because the hair is trying to go down, but because there's a lot of infection. There's a lot of
Disturbance
kind of a block along that airway, which is what the
infection.
cough is trying to eliminate. So you tend to get a lot of noises. So people will cough, but they also have a lot of noise, and then sometimes you can have a lot of running nose, what people commonly call catarrh or cold or blocked nose and all that. You can see that this child is struggling to get the airway, get hair down,
Free.
down through the airway. But if it is the lower airway part, the hair is already gone down, but the hair is supposed to come out as well. So you see that the children also
Mm-hmm.
struggles to bring out the
Bring
hair.
it out.
So that is when you begin to get things like noise that are what we call wheezes, because it is at the lower parts. The problem here is the hair not going down. The problem here is the hair trying to come out and
Yes.
it's having
Yes.
difficulty coming out. So those are the ways. So when a child coughs, the cough alone doesn't tell us anything. There must be other symptoms with the cough that help us to know what is causing the cough. Okay, so I'm giving you a scenario. If a child was eating a big bowl of a bar and maybe with meat, and then the child started coughing, the commonest possible cause is that that child is aspirating, the food is going the wrong way. Sometimes when babies are very hungry and you put them to the breast and they begin to quickly gulp
So
the
very
breast milk,
fast.
you sometimes see them start coughing. What has happened? Some of the breast milk is going down the
Very
other pathway, which is the airway. So they quickly, and what reflex, even mothers as a reflex begin to just what do? You
fast.
just quickly pass them and try to support them to make sure that um,
The airway becomes free.
the whatever is blocking the airway is out. Okay, fine. So when the child is coughing and there's a lot of runny nose and there are lots of noises and all that,
Using
it
some.
suggests to us it's an upper airway infection. Most of the time, sometimes it's not always that very, very clear. But for most of us, we begin to figure out it's most likely an upper, and whether during those who live in winter area when the weather is cold and things like that. So that's another thing. So those are the ways by which we know. For if a child is coughing for a short period, most likely it's an acute respiratory tract infection and all that. But if a child is coughing for so long, you know, or then whether there's fever or no fever. If there's fever and it's a short one, then I mean, if there's no fever and it's a short one, it's most likely something acute. When we say acute, it means something short, and that's it. Anything not lasts more than 2 weeks, that is short acute cough. But when the child is coughing for too long, this child coughs almost every day for the past 1 month, for the past, mothers will ask us 2 weeks, mother. So that is becoming what we call chronic cough. When a child is coughing all the time, or maybe the child coughs every night, or maybe the child coughs every time the child wakes up in the morning, must cough first, and then we'll get better there. But every night the child coughs, and then that is like every day for 1 month or things like that, then that is becoming what we call chronic cough. So the cause of the cough may be different depending on whether it's acute, with something lasting less than 2 weeks, or whether it's chronic, something lasting more than 2 weeks,
More
or
than
whether
two
there's
weeks.
fever with it, or whether there's no fever with it. So if there's fever with it, we think of infection. If there's no fever with it, we think of other causes. And so those are the various ways. So the problem is not the cough. Okay, the cough is just telling us something is wrong, and it's trying to
Something
tell
is wrong.
us what can we do about it. So and that's very, very important for us as a pediatrician, because I'm going to shake a table now because mothers want to give cough syrup anytime a child is coughing. And what does cough syrup do? Cough syrup basically is to suppress the cough. It just means stop coughing, because of course the cough is irritating. And I can understand that as a mother, you are just like, why is this child coughing? Just stop coughing. But that is not the problem. Remember this long introduction I've just done? It's just to arrive at this point to say the cough is telling you something. It's telling you something is not
Is
right,
wrong.
and something is wrong, and please deal with it. So what you need to do is to deal with what's discussing the cough. It's not to suppress the cough. Of course, sometimes you are dealing with what is causing the cough, and the cough is still so distressing and it's still so bad, and you just want, like, okay, yes, I'm dealing with the cough already. Can you just please keep quiet? I mean, can you just stop? I've already gotten your information. I'm dealing with it. So can you just be calm and let this child rest from coughing? Yes. So sometimes, yeah, cough syrup will come. That's where cough syrup will come in. But as much as possible, especially for those of us in pediatrics in children, we really don't want you to run to. It's easier for adults because you can easily explain to us what is going on with you and all that. But children sometimes they can't explain. So we really need that cough as a sign for us to know what is wrong. But if you suppress the cough without dealing with what is causing the cough, then we may run into trouble. And last on Wednesday, I talk about healthy living in 2019, and in the group discussion on ATP group. If you missed it, is still there. You can go and watch it because it was a video PowerPoint presentation. And I talk about the fact that we really need to be careful when, the way we give drugs to children. So one of the ways by which one of the things mothers do is when a child has cough, I mentioned one of the common killers, one of the leading causes of deaths of our children. And one of them is what? Pneumonia. Pneumonia is killing children. Now, and one of the things that came out of that presentation was that for a condition that we know the cause, a condition that we can treat easily, a condition that we can easily diagnose, why is so many of our children? I mean, it's a very serious matter. It's a very serious matter. Why is pneumonia is one of the top 5 killers of our children? It really was even in this what we call developing countries. It's because when the children have cough, mothers give cough syrup. They suppress the cough. They don't go to the hospital because when the cough stops, then the mother stops worrying about that child. And then the pneumonia is killing the child. Because sometimes the cough is a sign of a child who is having pneumonia. So, but if the mother quickly gives cough syrup, she suppresses that cough, she doesn't take the child to the hospital, the pneumonia will progress, and children are they rely so much on breathing. So when children cannot breathe, that's the end of it. And once pneumonia affects them, you don't present on time and the pneumonia is not treated on time, then the children are going to die. So that is one of the reasons why our children are still dying from pneumonia. And that is why we pediatricians, we frown heavily on you using cough syrup, because we don't want you to suppress the cough. Let the child cough so that when the child keeps coughing, there's a problem, then you can come to us. And then we can deal with it. Rather than you say, oh, it's not coughing again. Then the next time you are going to wake up, the child is not breathing well, or the child is breathing too fast. And when children breathe too fast, it's a lot of work. Then they get tired and then they stop breathing, and that's it. The child is gone. So that is one of the reasons why we don't want to take a cough syrup. So just know that cough is a reflex. Cough is telling you something is wrong. Do something about it. And when you do something about it, it's to address the underlying symptom. It's just the same way, like if somebody has fever. Fever is not the problem. Fever is also telling you something is wrong. It could be malaria. It could be anything else. Deal with it. So it's just like somebody taking paracetamol for malaria. Paracetamol is not the treatment for malaria. Paracetamol will just bring down your fever. And then if you don't treat it, malaria is still one of the top killers as well of our children. And it's because we also just give paracetamol and we don't treat the malaria, and then the child would die from severe malaria. The same way with cough. Cough is not the problem. Cough is just a symptom telling you something is wrong. It is pneumonia. It is asthma. It is tuberculosis. Treat the tuberculosis, treat the pneumonia, treat the asthma, then the child will be fine. But if you don't do that, then the pneumonia will kill the child. So this is one of the things we really need to talk about, So I hope it is very clear. So you can ask your questions now. Any question you have, we're going to feature it live and we can address it immediately. So please drop your question for us in comments. And if you are on our watch party, I will want our moderators to help us copy questions on the watch party and bring it down to the page, because we can only see questions that are dropped directly under the video on the page. And so if you're asking questions on the watch party, you may need to move to the page, or maybe some of our moderators will help us to gather the questions and drop it for us so that we can begin to address them. Thank you. Thank you so much for joining us.
Thank you, Dr. Bimi. That was a very thorough lecture. Yes, and I hope we're learning. This year, our target is to reduce deaths in children as much as possible. Please, let's not just watch these videos. Let us learn and teach other people as well. Dr. Bimi is still here. Please share the videos so that your friends can have an opportunity to learn as well. And then please send in your questions. Dr. Bimi, I am learning as well. But
Yeah.
you said something that it's an infection. And is it always contagious? Do we always have to separate other children when the cough starts, even before we know what the underlying effect is?
Okay, yeah. So most of the cough in children are due to it depends. There are different kind of infection that can cause cough in children. So the commonest route for cough for infections like that to happen is through the airway routes, aerosol borne. Yeah, I think that's the word. So when a child coughs, in the process of trying to eliminate those viruses or the bacteria, it's going to it's get dispersed into the air. So other children will
I
inhale that
understand.
and they too will cough. So if it's not a contagious disease like if you get HIV or something dangerous or even like tuberculosis, but because other children will also end up having the cough and then it become a vicious cycle. And that's the problem we have with daycares and crutches because one child has cough, then and that comes to the crutch or to the daycare or to school, and then all the children are infected. Then that one gets well, the new people start, and it's just like a vicious cycle and a vicious cycle. So that's what we say when a child is having cough and is having infection, you may want to keep them at home for a while so that they can get better first, and after that you can now um they can now resume school. So most of it, that's if it's something due to infection, but remember there are cough that are not due to infection. So
Just,
things
yeah,
like
like
asthma, a child who has
choking,
an asthma kind of cough, it is not infectious. So
infections.
a
Okay.
child, so that kind of a child cannot infect a child. But a child who has tuberculosis, a child who has pneumonia,
Can
they
infect other
they
children.
can cough out and the other children will be exposed to them, and that can lead to uh, that kind of a situation. So yeah, so as much as possible, when children are coughing or when they're having respiratory tract infection, you want to keep them at home so that they get better first. Yes, so that's that.
All right. Thank you for that. We're
So
still
while
here.
we're
We're waiting
waiting
for your
for our
questions.
yes, while we're waiting for our question, I will just go on to say if a child has, I'll start talking about what you can do as parent because I think that's what mother wants to ask me because Dr. Baby is saying don't give cough syrup now. What should we do? What should we do? Okay, fine. So if your child is coughing, what I would recommend you do first is observe the child. Is there running nose? Is there fever
Mhm.
or not? If the child has fever, no, sorry, let me start with a simple one. If the child has running nose, no
Yeah.
fever, the child coughs, you look at the breathing. You must take off the chest, the clothes of the
Sure.
child, and look at the breathing. Is the child breathing with difficulty or the child is not breathing with difficulty? So most children just cough, no fever, no difficulty with breathing, nothing else. For such children, most likely it's just a viral thing. So,
Okay.
or maybe they may even have running nose, blocked nose, and all that. So, all you need to do for them is keep them warm, give them things that are liquids, a lot of rehydrate them, give them a lot of liquids, and just keep them warm. Vitamin C is good as well in terms of helping prevent, and sometimes it can help you suppress those kind of viral. In other words, what vitamin C does is that it just builds the immune system, your body. So let me backtrack a little by saying there are things that your body can fight by itself. It is not every
Excellent.
time that you really need to help it. So
Drugs.
remember what I talked about the cough. The cough itself is one of the way the body is trying to
Help
eliminate
itself.
that infection or that irritant. So there are things our body does for itself that you don't even need to help it. We have a very wonderful body that has a very strong immune system, except for those who have immune suppressive diseases like HIV. Normally, your body fights a lot without you even knowing it. Your body protects you. So, and that's one of the reasons why we say you should get immunization as well, so that your body immune system is really is really properly jacked up to deal with some of these things. So for those kind of children, cough, no fever, no difficulty with breathing, maybe a little catarrh, maybe a little runny nose, keep the child warm. If you like, give vitamin C, something to boost the immune system. Within within 10 days, max 14 days, it will clear. You don't need to give antibiotics. You don't really need to give capsule. You don't need to give anything. So that is that. And so, but if your child has cough and has fever, keyword fever, and or the child is also having difficulty with breathing, so you take out the clothes of the child and you can hear the child breathing with difficulty, or you can hear some, or the cough has some certain noises. I know it's difficult I'm not a very good actress. I'm not sure I can replicate some of those sounds, but there's something called the packing sounds. There's so those kind of thing. But any child who has breathing difficulty with a cough, whether with fever or without fever, that child is not a candidate for you as a mother to treat. That is a child that really needs to be seen by a doctor. So that is a point where you should know that, oh, this child is coughing but it's not having fever, or this child is having difficulty with breathing, or it's making sound like whistles, another kind of sound, or he's making all those. There's a way the cough sounds. You just know that this cough is sounding. Mothers have a way of just knowing that there's something. This cough is not sounding. There's something wrong. That is the point where you know, because now we can be talking about pneumonia. We can be talking about asthma. These are things that require urgent interventions, and if you don't treat it urgently, the children can die. So at that point, you really need to take a child to the hospital. So those are the things that you wish you can do as a professional. I mean, as a parent, sorry. I think we begin to have some questions. Let's begin to feature them so that we don't run late. Yes.
All right. This is a question from Tim from Show. Compliments and well done, ma'am. What are the examination a coughing child will undergo before drug prescription?
Okay. Thank you, Temitope. So, when a child, I think I'll just continue for where I stopped, because you just seem to take the question right from my lips. Anyway, so when a child has cough with fever, or cough with difficulty breathing, or fast breathing, in fact, in some places we try to teach mother how to count respiratory rate, but sometimes it's so hard for mothers to get it. But once a child is having cough, and it is not just cough alone without any other thing, the child is not having cough with fever, with difficulty with breathing, or with fast breathing, you will know. You see the chest is going in and out very fast. Just take the child to the hospital. So when you get to the hospital, you see my colleagues, doctors, pediatricians, and what we normally do, we count the respiratory rates. So there's a normal count. There's a normal amount of time you should breathe in 1 minute for everybody. But the rate in children is different from that of adults, and the rate in newborn babies is different from that in infants, is different from that in toddlers. So I'm not going to go into all that. That's the job of the profession. But we will count it, and then we also look at whether the child is using what we call accessory muscles of respiration. In other words, the child is breathing with difficulty. So one of the way you see that the nose will be flaring. You see, when a child is breathing with difficulty, there are ways by which you can know that this is difficult breathing. The nose is flaring. You can see the nose go in and out, go in and out. That is flaring. You can see the muscles in the neck go in. Maybe next time I would have brought pictures or videos to show us. You will see that the muscles is going in. The spaces between the bones, the ribs, they are going in and out. When you see all those signs, and then you yourself, you will see that this child is really struggling to breathe. So those are signs that shows that this child is having fever, is having difficulty with breathing, and all that. Then of course the doctor will now listen with our stethoscope. That's one of the reasons why we have stethoscope, and we listen for the airway. We listen to how the air is coming in. There's a normal breath sound we call vesicular breath sound. There's an abdominal one. There's what we also call bronchial breath sound that tells us there's some complications in the lungs and all that. Anyway, we will do the chest examination. Don't worry about the details of it. But based on that, we will decide. So you see your doctor telling you, oh, the chest is clear. If the doctor is telling your chest is clear, that means that, okay, we think this problem is an upper airway thing. And most of the upper airway thing, there are maybe viruses and whatever, or If there's some other sounds in the chest that the doctor will tell you the chest is not clear, maybe there's pneumonia, maybe it's not even just ordinary pneumonia, there's complication with the pneumonia as well. So then those kind of children may need antibiotics, they may need oxygen, they may need hospital admissions. And you see, and the earlier the doctor starts to deal with that, the better for the child. Because if we delay, that is when pneumonia will now lead to what? To death in our children. So that's what we will do. It is when we do that that we decide, does the child need antibiotics or does the child don't need it. Because sometimes we examine your child, we think the doctor will say, don't worry, child doesn't need any antibiotics. And mothers always find that very frustrating. That how can you examine my child and say there's no need for drugs? If the chest is clear, the child doesn't have fever, the child doesn't have got everything, we think it's not like a viral thing, then there's no need to give the child drugs. The child can fight it on his own. That's what we normally tell you. Yeah. I hope that answer your question, Timothy. Yeah, let's go on.
All right. Do you have more questions, Dr. Femi?
Next question, okay?
Mom, do we have more questions?
Yes.
Okay.
I've posted one on the group. So a berry fever is asking, after taking the child to the doctor and you prescribe drug for the child, and after taking the drugs, the cough continue, what can one do? Very good. Thank you. That's a very, very important question. Yes. So most times mothers take the child to the hospital and the pediatrician have seen the child. If we think it's a pneumonia or something, and pneumonia has different grade as well. We have what we call community acquired pneumonia. We have the pneumonia that simple pneumonia, we just treat it with oral antibiotics. We send your baby home. We have the severe one, like the one I described, that the child need oxygen, the child need IV antibiotics. We'll put the child on the hospital bed. Now, most mothers will take the cough, the drugs, and the cough has not disappeared. Now then they're getting worried. Now the problem, remember where I started from, the cough is not the problem. The problem is what is causing the cough. Now, also when the child has been treated, the cough itself is always the last thing to go. In other words, even after you dealt with the symptoms, because when you take antibiotics, the bacteria are killed, the body will try to clear them off. So that the resolution of all those what we call inflammation and all those, it takes a while. So the cough may persist, but what you will notice that the fever has gone, the difficulty in breathing has gone, and all that has gone. So you don't need to worry. It means that the child is better. So you may decide not to worry, just watch it. Sometimes the cough, we say it lags. It doesn't disappear immediately, even after you've treated your underlying cause, but it will eventually go. So so you don't need to worry, you don't need to panic. But if you are not comfortable, you think, oh, I'm not sure this thing is being cleared, then you take the child back to your doctor. So this is even just a general advice for mothers. Anytime you have been treated by a doctor or by any professional, and whatever we say we've treated your child for is still continuing after you completed our treatment, no problem, just go back. There's what we call follow-up. So, but unfortunately, most mothers just get discouraged because they always expect that immediately the doctor gives me medication, even one day, immediately I take that one dose, the thing should disappear. It's a lie. It won't disappear in one day because it takes time for the symptoms to build up. It takes time for that process to happen. So it also will take time for it to resolve. So we can't give you drug. You've taken the first dose and say, the child is still coughing, the child is still having fever. These doctors, they don't know what they're doing. Let me go and try this other alternative. No, be patient. And that's general advice for mothers in 2019. Please be patient with us. So be patient, use your medication. In fact, I always say tell parents that, like, if you are using antibiotics, before you begin to say whether it's working or not, you need to have this for like 48 to 72 hours. Sometimes it takes that long for you to see the effects of the medication. Before the medication goes into your child's body, it needs to build up to a certain level. It needs to deal with all those bacteria. The bacteria needs to go then before the symptoms will begin to disappear. So sometimes it takes you like 48 hours before you even begin to notice any effect. Sometimes it's very immediate. Yes, we are happy, but sometimes it may take. So before we begin to even worry, we'll say, I've used it for like 2 days, I've used it for like 3 days. It is after that, they will now say, okay, if after 2-3 days the thing is still not showing it's still not shaking body at all, then we will now say, okay, Is it that this drug is not working? Is it that this is not the appropriate drug for your child? Do we need to try another drug? Or is it that your child is resistant? This is one of the dangers of those antibiotics resistance we've been talking about. Because when you use antibiotics, when we don't prescribe it, then when you now need it, we'll prescribe it, it will not work because your body, the child has developed resistance. Okay, sorry, apologies for that. I think my internet went off. Are you with me? Hello?
I apologize for the breaking transmission. Dr.
Okay,
Mimi,
sorry
welcome
about
back.
that. My internet went off, but I'm back now. Okay,
Okay.
so I was just telling Ebere about the
Ebere.
fact that when your child is not better, please take the child back to the hospital, and then we can the doctor will know what to do. All right, so let's just continue with the questions.
All right.
Um, Papa, can you read the next question for us?
Okay. I'm not sure I can.
Okay,
I
okay. So
still.
what if? Okay, have you seen it now?
No.
Okay, so what if you have a child with cough that is persistent and no fever? What do you do next? So if you have a cough if you have a child with cough that is persistent and no fever, it's possible it's one of what we call the chronic cough, and the commonest cause of such cough is asthma. In most parts of the world, is one of the commonest cause of chronic cough in children. So what I would advise you is to take that child to see a pediatrician who will now examine the child and then decide on the appropriate treatment for the child. Okay, so the best thing to do for such a child is to take the child to the hospital, and then the pediatrician will be able to um, uh, uh, I mean, examine the child and decide to treat her appropriately. Okay. Yes, let's
Okay,
go
this is
on.
Timitope.
Yeah.
She's asking if vitamin C is good. Now you said vitamin C is good. Does it mean we can? There's no overdose.
Okay, vitamin C is good, but I'm not saying that we should overdose on it. It's very difficult to actually overdose on it because your body eliminates whatever is excess. It's a water. That's the advantage of vitamin C compared to the other vitamins. Vitamin C is a water soluble vitamin. Vitamin B and C, they are what we call water soluble vitamins, and vitamin A, D, E, K, they are the fat soluble vitamins. So the water soluble vitamins, it means that the body doesn't store them. So when you take too much than what the body needs, the body
So
just
eliminate it.
remove them from the system. But we don't also want you to overload the kidney by giving too much and all that. So just give within what is recommended. If you check every bottle, like most children, they need to take like maybe 50 milligram tablet, one tablet, or 100 milligram max in a day. That is still within normal. But when you are now taking too much, I know that people that preaches mega doses, but I'm not encouraging that. But there's still a very wide, safe margin in the sense that your body can eliminate whatever is excess from you.
Mm,
Yeah. So I hope that is
okay.
okay. So it's good to give vitamin C, but alternatively, you don't have to give vitamin C. You can
Okay.
give
You can
fruits. Give
fruits.
if you are worried about giving the tablet vitamin C from the pharmacy, you have alternative. Just give your fruits, lemon, your citrus fruits, lemons, what else? That one,
Orange,
oranges. They all have high
tangerine.
doses of vitamin C. So when you give such, you get your vitamin C from them. So you don't necessarily have to buy from the store. So a natural is always better. Vegetables, tomatoes, those are the good
Food.
sources
Food.
of vitamin C that you can also get. Yeah, thank you.
Fine. All right. This is from Samson Design. Well done, ma. What are the precautions to take? Okay.
Okay,
I
I
think
think
the
something is trying to ask me what are the preventive
preventive
measures
measures.
when it comes to
Okay.
cough. Yes, and I think it's a very good question for
Question.
children.
Yeah.
Now, like we rightly said, there are things that irritates the children airway and makes them cough. And one of the things I really want to talk about is smoking. We don't want adults smoking around. I know our children don't smoke, hopefully, but we don't want adults smoking around
Smoking
children. If
around
you
them.
are a parent listening to me and you are a smoker, you are not helping the children. You know what smoking does? The cough, for you to cough, there are what we call sensors in the airway. So they are what we call, they are like cilia, they are like very tiny processes that line up the airway. So when there's irritant, those ciliary process, they pick it up, and then they start that process that makes you to cough and remove those irritants or the foreign body. But if you're a smoker, what smoke does is that it destroys those ciliary cells. It destroys them. And if you look at the airway of a smoker, it destroys all those things. So, and that is why they are prone to having respiratory problems because they don't pick up when they have those, the normal protective processes that have been destroyed. And so, if you are a smoker, please don't smoke around children. And for your
And
own health and for
children.
the health of the people around you, and because children are secondary smokers, and children cannot even eliminate the smoke, so you, the smoker, you breathe in, you breathe out, but the secondary passive smokers can't do that, so they are even more at
At
risk
risk.
than even you that is smoking. So one of these good resolution for 2019 is to stop smoking and not to smoke around children. Parents, please don't
Children.
smoke around children. But that's not the only thing. What other things? We need to make sure that we have good ventilation. Always keep the windows open. Some of us we just lock up the whole house everywhere. You must always make sure there's a lot of ventilation and avoid air pollution. So it's not only smoking that causes air pollution. Other causes of air pollution, like things like when we fry
Morning.
things in the yes, when you fry. I know most of us Nigerians would like to fry our palm oil so that the soup will be very sweet and it will bring away all the vitamin A. But that's not even what I'm talking about today. Apart from the vitamin A you have taken away, the smoke is not good for the children. And that's one of the reasons it's also not good to all this firewood cooking and all that. The smoke is not good for the environment at all. So you want to we want to avoid all that. So that's why we recommend cooking with gas. It's not because it's because it's a clean fuel. There's less smoke, and all those smoke, when they go into the airway, they tend to disturb those ciliary cells that are protective. So we don't want the children exposed to smoke, whether from firewood, whether from smoking, whether from other fuel sources that actually indoor cooking. And as well as we don't keep that, some of us have young children, we are cooking and we take our children to the kitchen and we're frying and we're bleaching the oil, and all those things are not good for the children at all. So you want to avoid that. So those are precautions that we can take. Apart from that, we need to make sure that we take our children for the immunization. So like I rightly said, those of you that listened to me last week, there are immunization that are against pneumonia. So things like pneumococcal vaccines, you need to make sure that your children are fully immunized. Haemophilus influenza vaccine is part of the penta vaccines. Make sure your children take all this immunization. And one other thing I want to say is the fact that your children have mixed those immunization in the past does not mean they have missed them forever. If this is the first time you are realizing there are such immunization, please still go and take them. They are what we call, you can catch up with immunization. So you can go and take those immunizations as well. And, let's all contribute to make sure that our environment is our hair, So those in the villages they actually enjoy because they have fresh air. Most of our industries, they are all this thing they are raising into the atmosphere. All our cars that are releasing all those fumes from our cars, they're actually creating generator fumes. So we need to really deal with all of them so that our children will not be, because it's those air pollution that tends to cause all these airway problems. So we can do with it. So these are some of the things we can do about our children. Okay. Abigail is saying thank you, well done. Thank you for watching. And if you still have questions, we still have a few more minutes and you can, I'm not sure, I think that's the last comment I've seen. Okay. I think I've answered Siegu's questions. Yeah. So you need to take that child to the hospital, and if the child has asthma, actually, if there's also a family history of asthma, the earlier you sorted, the better. Okay. All right. So we're rounding up now. Sorry for the break we had before, but you have your questions, please ask. And if you are on the watch party, I hope our moderators, if you are there, I can't see any question from the watch party. So kindly help us bring down the question, and then we can see. Unless you want to check on your phone and see what question on the watch party, that we can quickly address them. So while we're doing that, I'm going to talk about chronic cough. In short, because this is one of the areas where sometimes we mix it. So a child who have cough fever, sometimes parents seem to know what to do. They take them to the hospital. But for children with chronic cough, sometimes parents just begin to give them this cough syrup all the time, and it's not the best. So the two most common causes of chronic cough is either bronchial asthma or a child with tuberculosis. And tuberculosis in children is so bad in that it can affect so many organs. So a child who has been coughing for more than 2 weeks is having chronic cough. Any cough more than 2 weeks is chronic cough, and you need to take that child to the hospital for proper evaluation so that the pediatricians or whoever can evaluate the child and decide whether is it asthma, is it tuberculosis. And usually those are the kind of children that we would do chest x-ray for. And x-ray is just for us to know whether there's any to see what is happening within the lungs, and then we can address it. And for children with asthma, they have medication that they need to take. So some of them have inhalers. That some of the inhalers they need to take it every day. There are some inhalers that they use only when they're having attacks. So, and if you're a parent and you have a child with asthma, you must know what to do, because you must have, we usually say that parents manage asthma and not the doctor. So you must know what to do when your children have asthma and how to deal with it. So, and it's very, very important that you go for regular checks. So there are regular asthma clinics that the children also need to attend. So, but if it's tuberculosis, the children usually are put on drugs, and these drugs they are put on it for like 6 months, 9 months, they have to take it sometimes up to 1 year. And I know it's a difficult thing to give children drugs for so long, but sometimes that's the only way we really need to eliminate it. But the best, and the funny thing, most children get tuberculosis from adults. Children usually get tuberculosis from adults with chronic cough. So if you see an elderly person who has been coughing for too long, please don't. You don't want children around them. And if you are one of them, please, you really need to go to the hospital, because most of our cases of tuberculosis in children, they are actually from adults who have tuberculosis, and they are the one, giving it to our children. So we want, and some of us would like to take our children to the villages, and they will stay with the grandparents. It's a good thing, but if the grandparents have been coughing for so long, you really want to take them to the hospital before you let the children stay with them, because that may be the reason why the children may end up having tuberculosis themselves, and then they begin to cough for so long. So that's another thing I would just like to add. So any cough that is going for more than 3 weeks is chronic cough. It could be asthma, it could be tuberculosis, it could be other things, but those kind of children really need to be seen at the hospital. And you don't want children around adults who are also been coughing for too long. Thank you.
Thank you, Dr. Gremi. Okay, I have a few questions. Let me see if I can take them quickly.
Yes, let's take them.
Please, how do I stop constant cough in a child, particularly a child that has just been treated for pneumonia?
Exactly. So I think we answered that previously. So if a child has been treated for pneumonia and the child is still coughing, I think you really need to go back to see the pediatricians for a follow-up, and then the pediatrician will tell you to do, because sometimes if a child is coughing for the first time, we may think it's pneumonia we treat. But if the child is still coughing afterward, they'll begin to think, is it pneumonia in the setting of a child who has bronchial asthma, or is there something else going on in the lungs? Do we need to do a chest x-ray if we have not done it before? And those are the things the pediatricians would like to do. So please, who is it? Always tell us who is asking the question so we can tell them. So please help us to go back to the pediatrician for that evaluation. Okay. Yeah. Thank you.
All right. Thank you. This is a question from Ufoma. So what do you advise we do when the cough is as a result, when the child coughs, and not go to the hospital until it becomes chronic?
Okay, I think I'm not sure I get that question. Is it that if the child is coughing, I've told you what to do. If the child does not have fever, the child does not have running nose, the child does not have difficulty with breathing,
easy sound.
No difficulty, no abdominal sounds and all that, you can just watch. It will resolve on its own. Those kind of coughs will not become chronic. They will resolve within 7 to 10 days because they are acute respiratory, most likely viral infections, and they will resolve. Just keep the child warm, give lots of fluids. You can give vitamin C, something to boost the immune system. That is fine. But if the child has fever with the cough, or the child has difficulty with breathing, you won't wait until it is chronic. You have to take it to the hospital. And if you think your child is always coughing, most likely sometimes chronic cough is a sign of asthma as well, even though they may not be having the wheezing sound. So those kind of children, like I said, any cough that persists for more than 2 weeks, you need to take them to see a pediatrician as well. Yeah.
Okay. This is, Doctor, what if the cough started as a result of dust? Can I still give cough syrup?
No. So I don't understand. You mean the child was exposed to dust and the child started coughing? So if you give cough syrup, what you are doing is the opposite of what you should be doing, because if a child is exposed to dust, the child is trying to eliminate those dust by coughing them out. So
Things,
if you give
okay.
cough syrup and you suppress it, you're actually not doing
You
the child
stop the
good.
cough.
But the second way of looking at it is that a child who is exposed to dust and say coughing, see a child who has allergy to dust. So like children with
Dust,
asthma,
okay.
the dust could be a trigger. So that's why some of those children, we said they should not sweep in the school. We always write it to the school. They say all children should be sweeping. There's some children that should not sweep because if they have asthma, when they sweep, they will get attacks. So if it's a child that when the child is exposed to dust, the child starts coughing, that means that child is likely having an asthma attack, especially if you've noticed something that happens all the time, or the child will start wheezing and all that. That's kind of children, you must have your inhalers, you must take them to see a pediatrician. So, and you must, as much as possible, avoid dust
Dust.
at all costs, because that's the trigger factor for them. So it
Okay.
depends. So if it's once off thing, I would say just leave it and watch. But if it's something that happens every time, it means it's a sign to tell you that that child most likely have bronchial asthma and is allergic to dust, and you should avoid dust. And when it happens, you need to give them in the inhalers. Yeah.
Thank you. This is from Tonya. There's so many. Let me see as much as we can take.
Okay, we have
That
very
my baby is
short
having
time to
persistent
go.
cough.
Yeah.
Yes. And runny nose. And under the nose is a wound. He is currently on ampiclox syrup, but the cough is still there. What can I do?
You have to take the
He
sharp
has
back
a
to the.
wound under the nose.
You have,
So,
yeah.
Tony, I hope you can hear that.
Yeah, if you use antibiotics, your child is not better, back to the hospital, see a pediatrician. That's the best advice, because cough pneumonia can become complicated. In fact, most of the children that I treat when I was in the teaching hospital setting is because the children have a cough, they've been treating, but they've become complicated. Sometimes children have what we call fluids in the lungs as a result of pneumonia, and we need to take them to the theater to remove that fluid, what we call pleural effusion. Sometimes children have pus in the lungs as a result of pneumonia. We need to take them to the hospital to remove the pus. These are things that no antibiotics is going to do for you. No, these are things that you as a parent cannot do. So when we say go back to the hospital, most of those children we need to do a chest X-ray. And when we do X-ray, we will not see the water in the lungs. We will see the pus in the lungs. Then we know that we need to go and put a chest tube and remove it. Those are complicated ones. And so that's why when a child is not better, you need to go back to the hospital, because it may have become a complicated pneumonia, and that we really need even the surgeons to be part of the management. I hope that is clear. Yeah. Thank you.
All right, this is from Presh. Ma, do we have pediatrician in healthcare centers? Because I can't afford private consultation.
No, we don't. We usually don't have a pediatrician in healthcare center. Primary, I guess you meant primary healthcare center, but we have pediatricians in hospitals. We have pediatricians in most of the general hospitals as well. So you can go to general hospital, you can go to the teaching hospitals if you're in Nigeria. Yeah.
Okay, this is from Jane. My son has been having cough and catarrh for 3 months now, off and on, and we've been to the hospital several times, running tests, and they said it's viral infection. We should just give him lots of water and juice, but I'm still worried.
3 months, I doubt. 3 months is too long for viral infections. I guess the menu is on and off, on and off. Yeah, I will really, I don't know which doctor you've been seeing, but if your child has been having that for 3 months, I would think something else, and I really think you should see a pediatrician. If you have not seen a pediatrician, please see one. Rather you see a pediatrician, maybe a pediatrician who is into respiratory specialty in a teaching hospital. 3 months is too long for a viral infection now. That's too long. Yeah. It could be allergic. It could be most likely if it's running cough, catarrh, and all that. Most likely your child may have allergic rhinitis. May have they may have some other things that tend to cause recurrent cough and catarrh. Of course, each episode may be triggered by a viral infection, but there's something underlying that we may need to deal with. That's kind of what I meant. Yeah.
Okay. Should we go on, Dr.
Yes, let's just go for 5 more minutes. Just be fast. I will just give you one line answers.
Okay.
Thank you for bearing with that.
My 10-year-old son coughs, especially at night, in the middle of the night. And after the medication, it stops, but it comes back again. What do I do? That's from Samuel.
Sound like a child with asthma. Sound like a child with bronchial asthma. Please see a pediatrician in a teaching hospital or where they run asthma clinic. That's a typical symptom of a child who have bronchial asthma. Actually, if you have a family history of asthma, yeah.
Okay.
And what it means is that kind of
this is from
Sorry, sorry, Okpe. What it means that that kind of a child will need to be on medication regularly so that the child doesn't start having cough. You may need to have an inhaler that uses regularly. Yeah. Go on.
Okay. Mental inhalation, is it completely safe for babies?
No, we are not saying mental inhalation. Do you mean steam? We do steam inhalation. I guess you meant maybe you now put mental in your to with the steam.
Mental.
But it's not. We usually it's not like I'm not saying you should go and put mentor directly in the child nose and all that. No, if you want to do steam inhalation, yes, I don't know, but make sure it's
Okay.
recommended. Not that you are just doing it, unless like if the child has airway difficulty with the spread. Usually why we do it is for children that babies sometimes they find difficult to bring out those flames and stuff in the nose, so it's blocked. So what you are trying to do is to get it softened so that it can run out on its own, nothing else. So there's no magic there. So you can use what we call a nasal saline nasal drops, or you can use steam inhalation. It's just the same thing, but please avoid this menthol. Maybe people put menthol in the hot water when they are doing steam inhalation, but
Yes, most
please
times, yes.
not menthol inhalation. I'm worried about the way you say menthol inhalation. No, not recommended. Yeah. Okay,
Okay.
good. Let's run off
This is Esther
again.
Olaoluwa. My 3-year-old has been coughing for 2 years now. We've gone to different hospitals, and they said the case is not asthmatic. It's not asthma. And secondly, he snores a lot while he sleeps and difficulty in breathing. What can be the cause?
Sound like a child that has what we call adenoid hypertrophy, and you need to see an ENT surgeon because they may need to take out that adenoids. Sometimes we leave it. Sometimes, oh, is that 2-year-old?
The
If it's
boy
a
is 3.
3 years old, yeah. If a 3-year-old, we may decide because sometimes by the time they're about 5, 6, the thing may go down on its own. But if it is really giving the child a lot of symptoms and the child is having difficulty with sleeping, snoring, we may need to take it out. So but you need to see an ENT surgeon first. They would that advise you on what to do. When people say they've gone to a lot of hospitals, sometimes they've not gone to the right hospital. Sometimes you've just gone to general doctors and all that. Most of those kind of cases require specialists. So sometimes you see me saying, go to the teaching hospital, go to say pediatrician, go to say, because sometimes there are some cases that if a doctor just see you once and go, and another doctor saw you and didn't have the background issue, they will not know that this
Background.
thing is something. So you may really need to see a specialist who take their time to deal with it. Because from what you've told me, even without seeing your child, I can guess what is going on. A child who is snoring, who is coughing for a long time, most likely may have adenoid hypertrophy. And sometimes once you take it out, that child is not going to get better. We try not to take it out, but because we just want to see whether it will resolve on its own. But sometimes
On its
some children have
own.
it so bad that they just have to take it out. That's the only solution. Yeah.
Okay. Nasiru is asking, can my 4-year-old chick still take pneumococcus?
4-year-old, yes, please, yes. If the child has not taken it before, please go ahead and take it. Even before the age of 5, as long as they're below 5, you can still take it, yes.
Okay. Okay, this is from Elizabeth. My girl coughs and she has been admitted for tonsils. What should I do to put an end to consistent tonsils?
The solution is actually to take out the tonsils. The permanent solution is to take out, to do what we call adenotonsillectomy. But like I probably said, the same thing with adenoids. Sometimes the pediatrician, or the ENT surgeon want to watch and see whether they will resolve on their own. Usually, most of the time, I think children are 5, 6, they go down on their own. But sometimes some children have it. One of the reasons why the surgeons will take it out, if your child is having the tonsillitis 6 times in a year, that is too frequent. They have to take out the tonsils. That's the solution. So you have to make. I know most parents are also scared of the surgery. It's a major surgery, but it's also not that major. It's a 1-day surgery. Most times children are going back home the same day. They can start taking food the same day. But sometimes that's just the final solution. Especially if the recurrent infection is too frequent. I mean, there's nothing we can do than to take it out.
Okay.
So see ENT
Yeah.
surgeons if you want them to take it out. They will tell you what to do.
Okay. My 1 year, 10-month-old was diagnosed of asthma. Been on vitamin C and inhaler to help boost his immune system, but he's always coughing. What can I do to reduce the cough?
That means that the
1 year, 10
treatment
months asthmatic.
is the child on an inhaler that the child uses every day. Child on a steroid inhaler. Did you get that from the question?
Um, From okay. No, she just said he's using inhaler
What
and
kind of
constant
inhaler?
vitamin C.
No,
It was not specified.
there are two type of inhalers. So for asthma, I think we'll take asthma another day. Let's not go into asthma today. I know it's something.
Today.
For asthma, there's what we call controller medication. They are controller inhalers. Then there are also what we call relieving medication, reliever, or something to break an attack. So most of the inhaler people use is that salbutamol Ventolin inhaler. It is just to break the attack. When the child is already having an attack, you use it to break it. But for children who are having cough all the time, they need to use something to prevent the attack from even happening. They need to use something to control the asthma itself. So that is usually a steroid. Most of the time, they are steroid or steroid with another what we call longer acting bronchodilators inhalers. So things like Seretide and things like that. I'm not doing advertisement, but I don't have other. I don't want. I have to use the words that people can easily recognize. So those are inhalers that these children have to take every day. So you need to take that child to an asthma clinic. Please, if you're in Lagos, go to a teaching hospital like Lutz. They always have a respiratory clinic. They have an asthma specialist. Any of the teaching hospitals, most of them have asthma clinics for children and they have for adults. So if you're, because it's very important to control asthma. Asthma can kill a child if it's not properly controlled. So it is very, very important. So if your child is coughing every day, it means your child is not on a controlling medication or the controlling medication is not being used properly. The dose is not appropriate. So you really need to see a pediatrician who is into asthma management. And you will get one in a teaching hospital. Some general hospitals also have asthma clinic, but teaching hospitals definitely will have. Yeah. Is that the last one?
Okay. This is the last one. Yes, yes.
Okay, finally.
My
Thank you
6 months
so
old
much.
baby has been coughing for a week, and she has tried steam inhalation, but it's not helping. Her pediatrician recommended erythromycin suspension, but it is making the stool of the baby loose, so she's worried about continuing the drug. And what can she do to help reduce the cough? 6 months old baby.
6 month old. Please, in 2019, I try not to put your doctors on the spot by just asking them things on the phone and they tell you go and try this, go and try that, because the doctor really needs to see your child. There are many reasons why a 6 month old could cough. We didn't even go into that. Cough could also happen in children who have heart diseases, holes in the heart and things like that. But of course they also have other symptoms. They will be weak, they will not want to feed well and all that. So the cough is something that can happen in so many conditions. So if a 6 month old has been coughing, I want to see that 6 month old. I don't want to put the child on any medication. And erythromycin is not the only medication for it's not the only antibiotic. So if your child could not tolerate erythromycin, there are alternative antibiotics. But I think it's better your pediatrician sees your child first before putting your child on erythromycin or any other antibiotic.
Okay.
All right. So 6 months old, please take the child to see. Let a pediatrician see the child and let them give you appropriate. Okay. So finally, we finished for
Yes,
today.
I
We
were
want
able
to
to take
say
her.
thank you for joining us on our ATP Live. We tried to take our question
The watch party.
from the watch party. Well, just to say that this program has been brought to you courtesy of Active Pediatrician Foundation. And if you want to be part of us, you want to partner with us, you can reach us. We have our Active Pediatrician Facebook group, we have our page, we have our website, and very soon we're going to have an app where you can put in your question and you get your answers immediately. So this program is open for sponsorship. You can advertise your products, you can advertise your services, or you can also donate to Ask the Pediatrician Foundation if you want to just bless us and so that we can keep on doing good things. So just do that. This is what we do on Ask the Pediatrician. We provide health seminars, we do all that, and we also do community outreaches. So there are many things we do. So you can support us as little as 1,000 naira monthly to help us to do a lot for the children. And this year we are going to all the states in Nigeria. We really are so determined to spread our tentacles everywhere. So we really appreciate you supporting Ask the Pediatrician Foundation. And thank you so much for joining us this morning. And if you want to watch all our previous Live. You can get it on our YouTube channel. All the previous ACP Live, we're always uploading it to our YouTube channel. And if you have questions after this broadcast, please do not drop it under the comments, because we will
Comment
not be able
box here.
to answer them after the program is after we finish. What you can do is to go to our Ask the Pediatrician Facebook group. If you just go to Facebook and type Ask the Pediatrician Facebook group, you will come up into our group, and we are there 24/6. We don't answer questions on Sundays, but we are there
Sundays.
Mondays to Saturdays, so you can drop your question. We have our professionals, we have our moderators, and they will answer your questions. And so that's the fastest ways. You can also email us if you have anonymous questions on ask@askthepediatricians.com, and then we will get back to you. So that is our information for you this morning. Thank you so much. Okay.
All right. Thank you for joining us. We hope you've learned something new. 2019, we're keeping our children safe and healthy. No child dying. All right. Thank you, Dr. B. Thank you, everyone.
Yeah. So thank you. Join us again next week, 10 o'clock.
Next
and
week, Saturday.
next week, Saturday. Thank you so much for joining us. Bye.
All right. See you then. Bye.